From the Toronto Star, I'm Raju Mudhar, and this matters. We all want to get back to normal as soon as possible. Two ideas that keep coming up that may help the world get back to what it was are contact tracing and immunity passports. These are ideas that governments and health officials are touting, with new approaches that could be integral to the reopening of society. There are several Asian countries, like Singapore and Taiwan, that have taken a high-tech approach to contact tracing, while Chile is the first country to attempt immunity passports, although they are calling them release certificates. But even with those examples, how these things work, and if they actually will, is still very much open to debate. To take us through the ins and outs of both contact tracing and immunity passports, our guest today is Sandro Contenta, a feature writer at the Toronto Star, whose most recent pieces have been about these two topics. Sandro, thank you so much for being with us.
Thank you for inviting me, Raju.
So, Sandro, there's been a lot of talk about both of these things. And let's start with the older of these things, contact tracing. What exactly is it, and how has it traditionally been done?
It's basically gumshoe detective work, and the goal is to break the chain of transmission of an infectious disease. So in Ontario, we have something called the Health Protection and Promotion Act, which actually lists diseases that have to get reported by a clinician or a doctor when they come across them. And so things like tuberculosis, hepatitis C, and this one, SARS-CoV-2, which is, the virus that causes COVID-19. So when a doctor comes across that, they report it to a public health unit, and then the public health unit gives it to one of its trackers. And these are people who would immediately get in touch with the person who's infected, so in this case, the COVID-19 infected person, and ask them who they've been in close contact with over the last 48 hours. And so they would get a list of names and, of course, advise the person who's infected to, stay at home and self-isolate for 14 days. And then the public health official would then call the list of close contacts that person had in the last 40 hours and advise them to do the same thing, to basically monitor if they have any symptoms over the next 14 days as they isolate. And then if one of those contacts, let's say they had 10 people that the infected person was in close contact with, if one of those 10 then develops symptoms, then you have to repeat the whole process. The public health official would then say to that person, so who were you in close contact with? And so on and so forth. It's really grunt work, but it's really necessary grunt work.
One of the things that you mentioned in your piece is that public health units, when they started doing this, found that Ontario's health databases were sort of inefficient for contact tracing, and they had to sort of start building their own. Why did they have to do that?
I think the short answer is just that the provincial database is fairly old. One of our colleagues reported that it's been around since 2005. And so you can imagine how slow and clunky that technology must be. And I think that's the main criticism, is that public health units have been finding that it takes forever to upload information to that system and forever to get it out, to extract it. And the head of the Middlesex London Health Unit in Southern Ontario mentioned to me the provincial system is especially poor in having the links and creating those links between the infected person and the people contacted, the close contacts that those people were with. And so it's especially hard for the health units to extract that information, to upload it and extract it when it comes to people that have been infected and their close contacts. So a couple of health units, including Toronto and London, have just gone off and built their own system that works in a much more efficient way.
So at first, there were a lot of estimates that we need a huge influx of people to do this contact tracing moving forward. And some of the moves started to be made, but basically this virus is just moving too fast for humans to count, right?
I think initially that's exactly what happened. These contact tracing units are relatively small. I mean, how many people do you need to trace tuberculosis every year, right? Suddenly, COVID-19 comes around and huge groups of people are getting infected all at the same time. And it's all happening exponentially. It's increasing exponentially. Very quickly, public health units across the country became strained. I mean, they just couldn't keep up. And so in Ontario, for example, in early April, the Ministry of Health passed an emergency resolution that allowed public health units to take on volunteers to boost the contact unit tracing work and to get it done. So initially they were overwhelmed and steps were taken to try to sort of mitigate that. Now, though, I mean, interestingly, when suddenly things get locked down, then the work kind of slows down because if you or I are stuck in our homes and can't go out, then we're contacting fewer people, right? We're in contact with fewer people. And so if you or I get infected, when a public health official calls us up, well, how many people have you been in contact with in the last 48 hours? Well, one or two, right? And so there's fewer people to track at this stage, but people still want to beef up because, of course, we're very close now to opening the faucet, so to speak, and letting people back outdoors so that we can restart the economy. And that's when the great numbers of contacts are going to resume, the normal number of contacts are going to resume, and that work is going to become all the more important. And that's where you get people talking about, well, to do that, when we reopen the economy, we're going to probably need technical support to do it, such as, digital apps.
Let's talk about those apps. I mean, Google and Apple are supposedly working on these things. This is not as easy as it sounds. Why?
Well, it's not as easy as it sounds because, for one thing, it's technology, right? And so we are all familiar with it, and we're familiar with all the many glitches that we have to put up with technology, right? So there's just that aspect of it. If you have these apps and they're supposed to determine either location data or how close you were with somebody else that would then need to be notified as a close contact, you can just imagine sometimes it'll work, sometimes it might not, and you could be notifying people to self-isolate when they don't need to. So there's certainly technical glitches that will have to be worked out, and we'll see how effective these apps are. The other hurdle, of course, is that the only way they work is if a lot of people download the apps, right? If you only have like 10% of the population with these apps, then they're not going to be very useful. They're not going to be detecting a lot of close contacts that should be detected. So somehow you're going to have to convince people that it's important for them to download this app. If we leave it as a voluntary thing, and it's going to be very hard to make it mandatory because we're supposed to still be a democratic society. So my guess is when these apps come online in Canada, for example, it's going to be voluntary. So we're going to have to convince people that it's in everybody's best interest to download these apps. That's going to be another hurdle. And the biggest ones, of course, are issues around privacy. And we already swim in a very big surveillance society. And this is a way of throwing that surveillance into hyperdrive, really. A lot of personal information is going to get stored somewhere, perhaps in central databases, and therefore will be the target of hackers and who knows what else, right? And so those are the biggest concerns. So it's not an easy thing to implement by any stretch.
Have we learned anything from the places that are already using these things right now?
Well, I think, in places like Singapore, Taiwan, Norway has just come up with a new one. The early analysis was that Singapore and Taiwan, one of the reasons they were able to control the epidemic as effectively as they did was because they were doing very good contact tracing. And both those countries were using these kind of apps. So I think certainly that became a model for a lot of other countries to say, hey, obviously this has some usefulness when you're fighting a pandemic and hoping that your healthcare system doesn't collapse under the weight of infected people. And we also learned the model that seems to be gaining more traction is the Singapore model, where they're using Bluetooth. So one Bluetooth device communicates with another Bluetooth device when it's within a range of, let's say, the 2-meter range that the best guess now is for infection purposes, right? And that's a little less privacy invasive than using GPS locations. So I think those countries have shown both the good and the bad because, of course, in China, the use of this technology was a lot more invasive and has shown, just what we should be avoiding, basically.
In the article that you wrote about this, you tell a story about Sheila Montague, who's a woman who does contact tracing. And there's a lovely anecdote about sort of the human connections that probably really helped one of the first cases here. Why did you want to make that point in the article?
Well, I think the point is that nothing beats the human touch, right? Once you get notified that you are infected or that you've been in close contact with somebody who has been infected, I mean, the first thing people are going to feel probably is fear. And one of the possible outcomes of this virus is death. And so to have somebody like a Sheila Montague call you up and have a reassuring voice at the other end of the line that tells you, you're going to get through this. Here's how you can get through this. Do you have somebody to do grocery shopping for you? If you don't, we're going to make sure somebody gets that done for you. Here's how you can isolate within a family, right? If you have kids at home. And just to have that kind of human touch makes all the difference, basically, about whether people are going to be panicked or not during this whole procedure over the 14 days. And of course, they're checking in with people every day. And the reassuring voice is coming every day to see how you're doing. And so if we do have these apps that come into play, and my guess is they will, we're seeing them pop up all over the place, along with making sure that they have to only be around for the pandemic, and then we should get rid of them and eliminate all of that data once it's served its purpose. We have to also make sure that they don't replace people like Sheila Montague, because the work they do is just basically irreplaceable.
Now let's move on to immunity passports. What exactly are these?
Well, immunity passports would, in theory, confer basically a stamp of free movement to anybody who gets one. And so if you would get an immunity passport, you'd be free to go out and work, play, and travel, and basically do all those normal things that we used to do before COVID came around. So in theory, that's what an immunity passport would do. It'd be basically a get out of jail card, a get out of your house card, basically.
What are the hurdles to these? I believe they rely on antibody tests. Are these reliable enough for this to actually work right now?
Well, no, the antibody tests at the moment are not very reliable. I mean, there was a study just very recently in the U.S. where scientists looked at 14 of these tests that are on the market, and only 3 of them were shown to be reliable in any consistent kind of way. So that's the first thing. There's no gold standard for how we determine whether somebody has the antibodies to fight COVID-19. So there's a lot of false positive tests out there. So you're told you have antibodies, but in fact, and you might therefore think you're immune, but in fact you aren't, because it's a false positive. So that's just one of the problems. The tests are still very much in their infancy. One assumes that the scientists are eventually going to get those kinks out of the way, and these tests will eventually start working as they should be working. But then the bigger issue is, no matter how reliable they are, is how immune is somebody who has antibodies? And that's the big question that no one has come to a conclusion on yet. I mean, are you immune for 6 months? Are you immune for a year? Frankly, no one knows. So those are a couple of the problems with these tests.
It's fair to say that the drive for these is basically to try and reopen the economy.
Yeah, absolutely. Because if somebody gets a stamp of immunity, then of course they should be out doing work. And there's obviously a lot of pressure already on governments to get people back into the workplace for all sorts of reasons. And this would be one of the ways to do it. And then, of course, there's some jobs where obviously these tests would have a much greater benefit than for others. For instance, if somebody is working in a long-term care home and we were sure that they were immune and therefore had this kind of immunity certificate, well, that would be great, right? So we know that this person can go in there, deal with a very vulnerable group of people, and everybody can relax because we know that they're immune. They're not going to be bringing the virus into a long-term care home. So yes, the pressure to get people back to work is one of the reasons this idea, which some call, frankly, clutching at straws, because it is so uncertain yet, the science around it. But that's what's driving it, trying to get people back into some kind of normality.
I think the biggest fear around these immunity passports is the idea that they could lead to a host of unintended consequences. I think I want to get to sort of the potential dystopian novel aspect of it. But one of the things that you mentioned was that it could lead to something based on the idea of chickenpox parties, which I think some folks may be too young to remember being a thing. But can you talk about what that means?
Yeah, before the vaccine, against chickenpox came around, there were these gatherings that people would have. The idea was that if you got chickenpox as a child, you were far more likely to come out of it relatively unscathed and recover from it than if you got chickenpox as an adult. And so the idea was to get it over with, basically, to get it when you're a kid. And so there were parents who would make sure that their kid was around an infected person so that they could get the chickenpox and get it over and done with, and then just get on with life and be immune, of course. So that's how things were. And then the vaccine came around. And even though those are far more rare occurrences, these so-called chickenpox parties, they do occur. I mean, there's still, anti-vaxxers, as they're called. I mean, people who are opposed to vaccines. There are still cases where they will have that happen. I was reading just last year that the governor of Kentucky has admitted to having his children be exposed to the virus when they were young because he didn't want them to get the vaccine. So it's rare, but it still goes on.
Do you think that there are people who'd want to try and find an immunity to COVID-19 by trying to catch it?
Well, see, that's the thing, right? I mean, imagine all the people that are suffering right now because their livelihoods have been taken away, basically. And so if an immunity passport is what gets you back to work and back to making a living, well, it's almost logical for somebody then to want to get the virus and get it over with and recover. And certainly if you're young and healthy, you're probably going to say to yourself, or you might say to yourself, I can survive this. I can get the virus and get it over with and get on with my life. And so I think there is a real danger that it opens the door to COVID parties, basically.
I think the further thing is the potential for more social inequality. And the idea from dystopian novels that we're going to have healthy people that can travel freely and the rest of us being shut in. What are the experts worried about that?
Yeah, I think that's the greatest concern, is that in many ways, these immunity passports would cement the kind of social divisions that already exist. The people who are able to work at home at the moment tend to be people that have more privileged work, right? They're more affluent, they have flexible workplaces like you and I have, and we can continue getting paid and working at home. And the people who can't are generally the working poor, who are in low-paid service sector jobs. They're driving buses, they're cleaning long-term care homes, and they're cleaning hospitals, and so on. And they're the ones going out there risking being infected every day. So to have immunity passports, in many ways, one of the concerns is that you almost make that a thing. And so you make that official. So all the low-income people are out there because they've hopefully recovered, some of them. Some of them will have died, of course, but they're going to be out there doing all the work while we continue to stay at home and work from home in the safety of our home. And so one of the concerns is that it cements what we're already seeing as the social disadvantages in the economy. And then it's just the fact that you have some people that are going to have a stamp of approval that others don't have. And it just raises all sorts of scenarios of past times in history when this has occurred. One bioethicist made references to the Nazi period and labeling people on their clothes. And as one bioethicist said to me, well, what happens if a group of immune people suddenly find themselves in contact with a non-immune? What are the risks of violence breaking out just to get rid of that non-immune, right? So it does open a whole bunch of sort of dystopian scenarios that I think a lot of people would want to avoid.
Where are Canadian officials on these right now?
Canada has set up basically an immunity task force. And so we're going to be spending a lot of money having blood test surveys conducted across the country to try to sort of work on these antibodies and to see if they can get us a step closer to understanding the issues around immunity. So that's where we are right now. We're basically jumping on this bandwagon of antibody research in the hopes that it could shed light on exactly how quickly we can reopen our economy and our lives.
I think we should reiterate, despite all the talk about these, the science just does not seem to be there yet for immunity passports or release certificates or whatever they want to call these, right?
Yeah, absolutely. The science isn't there with regards to antibody testing. There is no gold standard. But I think most people are confident that eventually the scientists will figure out a way to make that work. But what we're quite far from knowing whether things work or not is on the question of immunity itself. Most scientists believe now that people who have recovered from COVID-19 have some kind of immunity. Whether it lasts 6 months or a year, nobody knows. And the only way you're going to know how long your immunity lasts is by following people. Scientists will have to follow people for, let's say, what happens to them when the second wave of COVID hits? Are they still going to be immune? And so these are like long-term tracking studies that would have to take place to actually, before we understand really how immune people do become. And remember that respiratory viruses are notorious for mutating. So while you might be immune with this mutation of COVID, will you be immune with the second mutation of COVID? So those are the big questions that frankly are going to take longer than inpatient people have to figure out.
Sandro, thanks so much for joining us today.
You're welcome. Thank you.
Sandro Contenta is a feature writer with the Toronto Star. That's it for today. Thanks so much for joining us. This Matters is hosted and produced by me, Raju Mudhar, Adrian Chung, and Saba Etisaz. Produced and mixed by Sean Pattenden, and our director of programming is JP Foso. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.